Information about COVID-19 has been changing rapidly. You see it each and every day, from added symptoms to recommendations from the CDC about covering your face with some sort of cloth or mask. So 10 News reporter Liz Birch caught up with an expert to ask him some of your biggest questions.
Dr. Michael Tang is an associate professor at USF's Morsani College of Medicine, and he spent decades working on vaccines. So my first question for him was what he thought the biggest news of this week was.
I think our models have gotten a little bit better, and I think a lot of the new modeling is showing a little bit of decrease in mortality and morbidity, which is great.
He also mentioned that work has started on the vaccine, so I asked him when we can realistically expect one.
When I hear a year or a year and a half for a vaccine, this is a really aggressive estimate, a really optimistic opinion about when it can be done. And this is if everything goes right.
So it could be a little longer. But he says the good news is a lot of resources are going into developing the vaccine right now. This question came to me on Twitter, where username Donald asked, if you're asymptomatic carrying the virus, how long does it last in you?
If you're asymptomatic, you really don't know a start and a stop of when you got infected. What we do know from people who do have symptoms is that they are infectious both pre-symptomatically, so before they can show symptoms, and they're also infectious after they have symptoms. So it could be a fairly long time.
And finally, from my Instagram DMs, where username Jay asks, once a vaccine is developed, will it be needed yearly?
So if we do have a vaccine, it's probably going to be a vaccine that will protect you for a while. What we don't know is how long that protection will last.
Dr. Teng says he believes we have started to flatten the curve because of what he calls significant social distancing.